Hello, and welcome to another edition of BNEWS In Depth. I'm your host, Rich Hosford. April is Autism Awareness Month, and we wanted to bring you a show on that theme. Specifically, we were curious as to what type of training police officers receive when they respond to calls that, involving somebody on the spectrum, and what tools they have to help mitigate the situation. It turns out, quite a lot. This month, we have my interview with Burlington Police Officer Stephen Papagno, who heads up such training here in town. Let's get started. Officer Papagno, thank you for coming in and joining me today about this important subject, especially now that we're in Autism Awareness Month. So I appreciate you coming by.
Thank you very much for having me.
So I just wanted to kind of start. Is this how long has this kind of training been going on in Burlington? Is it a trend nationwide? Are a lot of police departments sort of engaging in training specifically for autism and other forms of disability?
It is a trend that's, the lack of a term, sweeping across the nation in law enforcement. I read an article about 2, maybe 3 years ago. The FBI determined that police response to the autism community is like the next horizon of law enforcement that needs to be addressed. I took on the program about 4, maybe 5 years ago. I volunteered to take the program under wing and try to run with it. I can't account for every department, but I know
Sure.
Burlington, we get pretty regular training in our department, in and out of the department. In-service covers it. There's lots of specialty trainings. Burlington is no stranger to that. Next month we have crisis intervention training, which gears a whole gamut of people from autism spectrum disorder to you name it.
And were there certain types of incidents that were happening that, not necessarily in Burlington, across the country, that sort of inspired people to say that this is something that we kind of need to take a different look at?
I would think so, yeah, Rich. For me personally, about 14 years ago, I was blessed. My wife and I, we have a 14-year-old son, and he was diagnosed with autism right around age 3. I took it upon myself to say, this is my responsibility to try to understand what's going on with him, but also to teach the guys I work with and other officers who are willing to listen how to interact with these wonderful people in our community. As you know, 1 in 59 people in society has been diagnosed with autism. What changed it for me was, I don't know how old the video is, but let's say 5, maybe 6 years ago. It was a town out west. A young teenage boy was in the park. He was on the autism spectrum, and he was trying to self-regulate in a park. The term usually referred to as stimming, or like self-soothing type of activities. I believe he had a string, and somebody might have called it in. Whatever brought the attention of the police to this young man. So I think from just watching the video, and the last thing I ever want to do is second guess what another officer is thinking and doing at that moment. But
Sure.
Perhaps he didn't have the training or the understanding of what autism, or ASD as it's sometimes referred to, really was. And the young man was telling him he's stimming, he's self-regulating, and he just didn't pick up on the tells to this young man. And then it got to the point where the young man was going to walk away on the video. The officer, he was like, "No, don't walk away from me." He wanted to get to the bottom of the situation. I think at that point he was interpreting the young man rather than a medical condition, or a diagnosis to possibly drug dependency or a drug reaction. We don't know. He lightly put his hands on him, and it got into a physical confrontation where inevitably the officer utilized his taser on this young man. When I saw that video, that was just very, it kind of got right to my core as
Sure.
an officer. I sincerely believe we as police officers, we don't get into this job to try to hurt people. We try to help people. If we can't recognize, we can't help.
Right.
And there's so many different things in the world, and we always have to have our head on a swivel. And in this particular case, putting myself in that other officer's shoes, I don't know, what could have, what could have benefited, him at that moment from going right to taser. Maybe it was something else, some other force option, some other questions. So that's why I really took it upon myself. And a situation, a video like that went viral, of course, and it just brought great negativity to his agency. And I think law enforcement as a whole, a lawsuit was filed, and these are the things we try to avoid at all costs.
Of course. So when you do the training, what are some of the, the topics that, you try to touch upon? What are some, like, the sort of the overall sort of, things that you try to convey to the officers?
Three things: recognition, understanding, and actions. Recognizing that not everything's in a cookie cutter. Now, in police work, there are many calls that we may have to interact instantaneously. If you want an exact, like if there's like an active shooter type of call, we can't really sit back and kind of think
Right.
about it for too long. We have to react. Somebody having a heart attack, we have to do CPR. We need to react. There's nothing wrong with actually just taking a deep breath and kind of looking at the whole situation, especially with the ASD world. So recognizing some of the cues. What is ASD? How does it make a person react? A lot of times their behavior may be deemed as disorderly or tumultuous or aggressive or combative. But in many cases in the autism world, it's actually language, it's communication that many people have never seen before. A young man could be, let's say, Shaw's, and the noise from the lights, the brightness, the sound, maybe they're selling something that's not so fresh, and it just disturbs them, and they have a hard time, explaining themselves or presenting, what's making them upset, and so that's how they communicate. They're upset, and they act out.
And there's different ways that, that they might interact with people that, send signals that they're not attempting to send. Is it correct?
Yes.
Things like eye contact are different
Yes.
and with people, with autism.
Yes,
Yeah.
I agree.
Or sort of explain some of the things that, they might do that might, without this training, be interpreted differently by an officer.
Oh, certainly. Well, one of the biggest things that I've seen in my years as law enforcement, even all the way back to days with college, when people don't make eye contact with us, sometimes we feel very suspicious about that.
Right.
Are they trying to avoid us? Are they lying? And there's a lot of science and there's a lot of studies about that. But in the ASD world, eye contact's not necessarily paramount. An autistic person can communicate with you if they have the ability to communicate with you, and they may not be looking at you. Doesn't mean they're not listening. Doesn't mean they're not trying to respond. Doesn't mean they're being disrespectful. It just means for some reason it's that auditory, the visual, inclusion that makes it really tough for them to want to look at. It's their brains are just wired a little different, and they just want to just kind of move along in one direction, and they will answer, and the answers will be probably what you're looking for. You just got to look for it.
Yeah. And I was, trying to do some research before today, and I saw that, some people with autism might be more likely to, when they see confrontation or possible, to run away, to do something like that. Is that something you try to tell your other officers, like, be aware that this might not mean that they're fleeing because they did something, but because they're just
Yes.
a reaction that they might have?
I agree, Rich. The basic body biological response of everyone is fight or flight,
Right.
and that's no different with somebody with autism. They may get scared from the noise, the helicopters, the child's missing in the woods, and all they hear is helicopters and sirens and dog barking. They might be scared. That might cause them to say, "Wow, I want to get away from that." We'll call it a stimulus. They want to get away from that, and it might cause them to run further into the woods, further into danger, rather than coming to the help that we're actually trying to provide. It's a misinterpretation, but it's just kind of the quandary we're faced,
Yeah. Are there other behaviors that sort of might be misinterpreted that you?
Oh, certainly. And I've interacted with a lot of people with autism. Sometimes they admit to things, or they say things in a certain manner that we may interpret as they're admitting to criminal activity. In one case, I spoke with a young man, and it was kind of like, wow, what was up with him? And it was actually not me, but another officer asked him, have you been drinking today? And the person was like, well, yeah, I drink every day. So this officer was like, oh, so maybe he's,
Right.
driving a car and he's had something alcoholic, which he shouldn't, and get behind the wheel. Well, there's a big difference between drinking a Coke
Yes.
and drinking a beer, or drinking a lot of beers and getting behind the wheel. So that's why I try to say recognize, hang on certain features and just expound on them. Okay, you've been drinking. What have you been drinking today? Which should be a standard question anyway for us officers. Oh, I had a glass of milk, I had a glass of water, and 4 Dr. Peppers. Well, that doesn't rise to the level of operating under the influence.
Right.
So that's why it's our job to kind of fish a little bit.
Yeah, so it seems like what you're kind of saying is, not take it at face value that like the way that I would respond to something is the way that other people will necessarily respond. Because obviously, somebody asked me if I've been drinking, I jump to the idea that, they have asked me if I've had an alcoholic beverage, but somebody else might not kind of interpret the question or frame their answer in the same way.
Exactly. One of the other things I try to train all our officers in discussions and roll call trainings that we do is autistic people can become victims of crime, but they can also inadvertently commit a crime as well. They may not even know they're committing a crime. I've seen one young autistic young man at the mall walked out of the newsstand with I think he grabbed some candy, and it was like, okay, yes, in and of itself, it wasn't, I don't think the young man had the intent, and it was just like, once we kind of got past all the what upfront stuff, we kind of was like, all right, this this is what it is. This is not this.
Right. So you talked about the training, and it's the first part is recognize.
Yes.
Well, first of all, what does the training look like? Is it classroom, role playing, a mixture? How does it? What's it look like?
Well, mostly for the department, it's just mostly classroom. One of the first things I started a little over a year ago is roll call training. Every day we start off our shift, we go into roll call, we get our assignments, and we talk about the important topics that that we need to kind of look out for during our tour of duty that day. And towards the end of it, then I do a PowerPoint presentation on, it's just a basic overview of what is autism, what does it look like, what does it sound like, some of the things to look for, some of the indicators, the cues, kind of think outside of the box. Never really underestimate who you're dealing with. Understand they're people just like us. Sometimes one of the phenomenons with autism is nonverbal. People are nonverbal, and they so desperately want to talk to you. They desperately want to say what happens to them, but they can't, or they can't get the right words out. It's our job to get that information. I often tell the guys at work, sort of in a situation like this where the fish is on the hook, it's our job to put the fish in the boat. It's not the fish's job to jump in the boat, So it's our job to get the right answers from these people. And if the person who we're interacting with can't give you the answers, then we look for other surrounding information, other caregivers, witnesses, people who happen to be by, anything that would just help us to better serve that particular moment.
Excellent. And so, forgive me, you said the first part is identify. What was the second?
Recognize.
Oh, recognize. Okay.
Recognize. There's a lot of oddities and peculiarities that people with autism may display as time goes along. Some are very obvious, some are not. I've seen some autistic people who have prone to blurting, or for no reason just up and yelling, rocking, the finger twiddles, the hand flaps, toe walking, and those are some more obvious signs. And there's some that are not, very quiet, reserved, just keeping to themselves, looking at their cell phone very intently, some video after video after video. So one of the things I like to kind of couple with the recognize is I just read a book from a comedian who's also autistic. He says, funny, you don't look autistic. That's the title of his book. And it's like, well, there's no big A on the forehead. And,
right.
It's kind of like not a visual type of diagnosis. So
Right. It's not like someone with Down syndrome kind of has a certain kind of
exactly.
look that we can sort of universally recognize. Are there certain techniques that you teach sort of when once an officer recognizes, okay, I'm, working with somebody, with autism now, to sort of change how they might interact with them compared to other people?
Oh, absolutely. Once once you have somebody who's on the spectrum, or you believe that they're on the spectrum, or even not necessarily, it could be anything, from Down syndrome,
Yeah.
autism, you name it. There's nothing wrong with a new approach at that point. Sometimes, like for example, you can ask somebody with autism a question. Where are you going to? Where are you coming from? A very simple question. It might take him a good minute or two to process it, to get his answer, and to give you the answer. Be patient. In my PowerPoints, time and time again, 3 words I stress: patience, patience, patience. You're here for 8 hours. Take your time. Get the right answer. Better to take your time, slow things down, figure out what you got, rather than push a bad position and we look negatively. Somebody gets hurt, somebody gets fired, somebody gets sued. These are the things we don't want. At a bare minimum, the person who we're interacting with doesn't get home, doesn't get the medical attention they need, doesn't, not able to explain what they need at that point. So that's one part of it. The recognition and is the biggest part of it, because sometimes you may go a while and be like, oh, now there's little things, oh, wait a minute.
Yeah.
Now wait a minute. Now, okay, so we started here, now we had here. And that's very a very good trait to have. It's generally a very good trait for them to put towards the people we talk with.
Excellent. Now, I know you brought some stuff, and I want to get to that. We're just going to take a quick break. When we come back, we'll go over some of the sort of ways that you can work with people in the moment to kind of help calm down.
That's excellent. Thank you.
In this next section, Officer Papagno explains what type of tools Burlington police officers have when working with people on the spectrum. Let's take a look. And we're back. And so you have some things. I understand that, sometimes when people with autism especially are in stressful situations, there's ways to help, calm down. So what do we have?
So this little kit I brought to show, it's a new incentive that the Burlington Police have been trying for roughly a year, maybe a little longer, a little bit less, in cooperation, speaking with Lieutenant Mills, and Chief Kent's been very, very receptive about some new ideas. What can we do to redirect someone who's in crisis? Time and time again, every symposium I've attended, every book I've ever read, every teacher I've ever spoke to, they say it's very difficult to prevent the behavior once the behavior is rolling along. Mm-hmm. It's much easier to redeflect the behavior, and that's what I try to teach the other officers in the department. And how do we redeflect that? Well, the first thing that I try to do is, if we get called to an area, a person in crisis situation, if there's a caregiver, a parent, a grandparent, a teacher, mm-hmm. a social worker, who might be there, what do you do? What do you do to redirect this person, the person you're with? How do you get them to redirect? How do you get them to calm down? Sometimes people are in such level of anxiety and such level of crisis, it's tough for them to de-escalate and come right back down to normal, so that we can calm them down, put them in a safe area, have them sit down for a little bit, and while they're distracted and nice and calm, we can figure out where our next steps. How do we get you home? How do we get a hold of your parents? Do you need to go to the doctors? Is this a medical reaction? Do we need to get the ambulance? Something like that. So we came up with an idea of just a basic, simple pencil kit, but has some things inside of it. The first thing that I include is just a basic standard fidget spinner. You get them at any gumball machine.
Yep.
I've used that with a lot of success. I had a young man over at the Wildwood Park. He was lost. He was very upset. He was wandering away from us. He was, his mother came up to him and says he was autistic, and she's never seen him like this before. I put that very fidget spinner down. I spun it. I walked away. He went from being upset and walked right over to it, picked it up, and he played with it. And I made a deal with him. You can keep the fidget spinner, and as long as you just stay out of the street, you can sit right here nice and calm while I talk to your mom. Worked like a dream. He was back home within 5 minutes with his mom, nice and safe. Nobody got hurt. Situation, mission accomplished. Another fidget spinner that I found through Autism Speaks. Not exactly sure how it works, but they just kind of directs their attention. You know, just is a little marble, a little snap link, something that just changes their mind. You know, I have them various sizes and colors.
Yeah. Just gotta hold them up so people
Oh,
can
sure.
see
I'm
them.
sorry.
No, that's fine.
I got this idea from a restaurant, the old standard wiki sticks. Not the most sophisticated of toys, but you know, I've used that a couple of occasions, and the young person just sat there and played with it while I was able to talk to their mother while they were in the mall, and the young person calmed down, and I'm like, okay, you can take those with you. Do you want to go home with your mom? And they were like, absolutely. So it was, I consider it a win.
Absolutely.
Some of the other things we do too is in the kit is I like to utilize the Autism Elopement form from Autism Speaks out of the Red Book. So each kit contains one, if you'd like to read it. And it's a standard form. You can get it online, or we have hundreds of them. I can hand out as many as you like.
Okay.
What I know when we do, if you live in town, or if you work in town, or if you go to school in town, or anything in Burlington, fill out the form, give me a call. We'll sit down, we can discuss the person who might have autism or some particular special need, not just autism, and just find out, okay, you know, my son, he goes to school at the lab program, and he has a penchant for wandering or running away when he gets upset. Well, this is great information. We fill this information out, I take a photograph. We have a program at the station called Safe Watch. So if you put in the name Joe Smith, date of birth, 1, 2, 3, 4, 5, it comes up. You know, if I've ever interacted with somebody and filled out one of these forms, it's right there. So when it comes out, the name comes up, you know, it gives us an alert. Okay, this person has autism, or this person is hard of hearing, or this person is Down syndrome, or whatever the case may be. So that way we have an idea, we understand, and we have just one more thing in our bag to play, you know, in a situation.
Right, and so, and for people who can't like really see this, it just, you know, it's got the basic information of, you know, name, address, birthday, age, things like that, but then also, you know, gender, hair color, identifying materials, and then sort of like as if you were at a doctor's office, sort of like what kind of conditions might apply to this person.
I'm a very big fan of this form. It's from Autism Speaks, and they're about one of the most wonderful front runners for the people with autism. But it has a lot of information in the event. One of the biggest phenomenons we as police have to deal with is the wandering. When you know, autistic people tend to can wander at any moment's notice.
Yeah, they just get distracted by something.
Exactly. It gets in their head. They bolt. A noise, a sound, a smell, something, and all of a sudden they run. It's a phenomenon. And so if they run away, and let's say they're running down towards the reservoir, well, there's a lot of hazards there. Too much to list in one show, you know. So now we have an idea, okay, he lives 1/10 of a mile from the reservoir. He's very attracted to water. One of the questions there, can the person swim? Mm-hmm. That's a big phenomenon across the world with ASD is autistic people are very attracted to water.
Yeah.
And if they don't swim, well, we can see a big problem with that. So we do the form, and once it's completed, and in the event like the person is missing for some time, you know, like missing for like 2 hours, and then we do come across them, we find them in the woods. We have information, and any of this information is all voluntary.
Right.
You know, you can tell me everything you want, or you could just tell me a little bit, as long as we know. And like, for example, one of them is the type of medications they may or may not be taking at that time. If a person is lost in the woods for 5, 6, 7, 10 hours, they're going to need medical attention. If they're on regular medications, then I can take this information and give it to the paramedics and say, these are his medications, his dosages. It's all confidential. It only gets maintained by first responders, given to first responders, to give to medical professions. And that's all it is. So it's a good heads up for us to have.
Yeah, and it's got some things that, you know, seems like in advance you're trying to, you know, work with families or caregivers to sort of say what's the best way to work with this individual in case we have to, because, you know, it says method of preferred communication, and it says, you know, nonverbal sign language, picture words, written words.
Exactly, yes.
And, favorite sort of toy, things like that we have here. So it seems like rather than sort of relying completely on the officers who, recognizing the situation during maybe sort of when something is going on, this is a nice way of having a kind of a heads up or something. And talk about how that does help.
Oh, how does that help? Oh, it's a tremendous help. Sometimes it's not what you say, it's how you say it in law enforcement. So, for example, if we get a call for a disturbance at, and I'll just make up a street, 123 Main Street.
Right.
We don't have a 123 Main Street, so just making that up. And we have a disturbance, and we don't have much more information. Maybe we got that information second or third hand. Who knows?
Right.
We go in there, it gets put into the computer. All of a sudden, up comes a notification. Person with autism lives at that home. Well, if that's the person who's having causing the disturbance, well, there's a big difference between a domestic disturbance between husband and wife or something violent like that, and a person with autism whose iPad died and he's upset he can't watch his favorite video. Right. There's a big difference right there. We may invariably get there, and it might be a domestic disturbance. It might be, a very, a call that we may have to come at a high level, but at least we have an idea of what's going in there, kind of going before going into the home, into the situation. So that way we hope to not overreact,
right,
or underreact. So just put something in the back of our minds,
Right, like I said, exactly. So it's a way of sort of knowing going in that, to be on the lookout for perhaps something else. And you have some other ways that people can do that.
Absolutely.
Stickers.
Some of the things, everybody loves stickers, it seems, but some of the stickers that I'm trying to utilize here and there, adult with autism, child with autism, they can be put on car seats, front doors. If we go, these particular stickers are for automobiles.
Okay.
So if we pull over a car for some civil motor vehicle infraction, and we see this sticker, well, then we might have to, we understand someone in that automobile may have been diagnosed with autism. We don't know exactly, how they're going to react, but at least we have in mind. And it says right here on the sticker, in case if we forget, it may not respond, resist and run away, may be nonverbal, may be unaware of danger. We don't know. Could be the driver, could be a passenger, we don't know. But at least if we see that, we take a second to say, okay,
right,
the situation exists, and let's react to it appropriate when it's time to react. I just kind of throw out some of these other stickers as well, just for variety. Once again, these are also great stickers to have in the event you get in a car accident. Car accidents are very prevalent. You never know when they're going to happen. Most of them are very small. Some of them can be very big. We get up on scene and we see a sticker that says "Child with Autism," and it's a really good-sized automobile crash, and the child might need to be extracted from the car. Obviously that's scary for anybody.
Right.
And now add an autistic person who's nonverbal, who can't explain to him, "I'm scared. This is really scaring me. What do I do? What should I do?" And that just adds to the stress of the situation. And if we're able to see something like that, we would be able to kind of recognize, okay, now we got to try maybe a little bit of a different approach. Invariably we may have to extract, from the car. We may have to do certain things, but at least it gives us options, how maybe we can do it a little bit differently and just be a little more aware and a little more patient and a little more understanding as to the person on the other side of the car.
And you said that, obviously these ones are for vehicles, but you could put ones on a door of a house.
Oh, absolutely.
I
have this one as well. This one I really like. If you live in a home, we can put a couple, like one on the front door, one on the back door. Nothing like, once again, 123 Main Street, report of a disturbance. Okay, we hear a lot of screaming and smashing and God knows what's going on behind there. And then we have to react. We go in the front door, we see a sign, emergency responders, an autistic person lives here. Well, that gives us a lot of things to be cognizant. Maybe that's the person who we're having the disturbance with and we didn't know. Maybe the disturbance is somewhere else with somebody else in the home, but we have an autistic person in the home that we need to keep an eye on. We don't know how they're going to react. Maybe they're running away. Maybe they're going to hide. Maybe they're so scared they run and they push themselves in a bad situation. So, A goes to B, B goes to C, that type of thing.
Right, absolutely. Now, one of the things that we were talking about before taping was, and you mentioned it just a minute ago, is the sort of propensity to be interested or drawn to water.
Yes.
And that's another thing that, sort of working with a family or having a family tell you in advance that, there's an autistic child or even an adult that lives here, that kind of gives you sort of a little bit more of a heads up in a wandering situation.
Yes, I agree.
And so what are some of the things that you can then sort of adjust if, that person is, reported missing?
So let's say we get a call at Main Street, the house on Main Street,
Right.
and an upset mother calls, my son's been missing for like an hour. So one of the questions we should ask from the beginning, all right, what's the situation? And, does your child have autism? In a situation like that should be what we call a red flag. And if the parent or the caller says, yes, my child is autistic, normally I would recommend one officer go to the home to actually ascertain what's going on. The other one, a second officer should go to the closest water body. They're hyper attracted to water. I've seen that firsthand with my son when he was young.
Yeah.
We'd go to the beach, I'd let go for a second, and I'd have to run down trying to, oh boy, this is before we knew he was autistic. And then once we found out, I'm like, wow, that makes a lot of sense. It's all about safety. It's all about response. Coupling with the elopement form that if one's filed with me, what I normally do on my own is I'll go to Google Earth and then I'll drive your neighborhood and I'll map out all the water sources that are by your particular home. That could be a concern to us. A pool in the backyard, the reservoir being 1/10 of a mile away, a little pond out in front of somebody's house. Anything that could be a hazard, I try to map that out and put it in so that responding officers can read that from the cruiser, because each cruiser has a laptop that can access this information and be like, all right, well, this young man's been reported as autistic. You know what, there's 5 or 6 guys at the house. Why don't I take a ride down to the reservoir and take a look? And hopefully we'll get lucky.
Yeah, great. Now, if there are families out there, who have autistic children or caregivers that work with them, are there other things that they can sort of do ahead of time to interact with you, to sort of make sure that you have all the information that they need or that you need?
Absolutely. Yes, absolutely. Please give me a call at the police station, 272-1212. Ask for Steve Papagno, or my email, spapagno, Papagno at bpd.org. I'd be happy to come down and discuss safety plans, things that you can do in your home. What are your concerns for your loved one? What we can do, what we should know, how, fill out the forms. We can alert the other officers. There's a lot of things we can do to help.
All right, excellent. Well, we're going to take one more quick break and come back to wrap it up with a little bit of talk about how to work with autistic people and they've been victims. And also, I want to expand a little bit, into your work with the fire department. And finally, we discuss what family members of people with autism can do ahead of time to work with the police and make sure that everybody stays healthy and safe. And we are back, and like I said, so we've been talking a lot, if there's a disturbance call or something and somebody with autism is, interacting with you as far as, possible suspect police officer. But is there a difference in how you interact with this population as far as, if they are perhaps the victim of, of a crime or abuse or...
If it's different, I would tend to say no.
Okay.
Because we can all we can all be victims of crimes, whether you're on the autism spectrum or neurotypical. Everybody can be a victim of a crime. But when people are, diagnosed with a specific condition, and they are victims of a crime, particularly some of the worst case crimes, a lot of times you don't see it. A lot of times you don't hear about it until it's almost too late. Or, we will investigate it, of course, as thoroughly and as professionally as we can. But if you're dealing with an autistic person who's nonverbal, that may be very, very difficult to ask him or her what occurred, how did it occur. They may not be able to. They desperately want to tell you,
Right.
but they may not be able to because of their physical limitations. So that's where we have to do much more of a intricate investigation and be much more patient and be much more thorough. And then, of course, we probably would have to discuss our investigation with the district attorney's office and the attorney generals, especially when it comes to somebody with special needs.
Right.
But any type of neglect or abuse investigation is always a tough one.
Of course.
You're always seeing somebody in an environment that's not in their best environment. They're having a really bad day. Sometimes things are small, some things are much bigger, but it's never the pretty part of our job.
No, of course.
So I think the best way for us to do it is professionally, in accordance with the law and our policies and our procedures, and just be as thorough as we can and open up the communication and have patience, much more patience.
Yeah, I guess what I was trying to get at is, if somebody was, a victim of like sexual abuse at home or something, do the sort of tells or signs that you or educators or somebody would look out for vary from somebody with autism versus somebody who doesn't?
Well, I would say any type of a sexual assault, the indicators are the indicators.
Yeah. Okay.
But if you have someone who's not on the autism spectrum, many times due to the victimization, they don't want to discuss it.
Yeah.
And then we have trained professionals who want to discuss at a timely at a very good pace, because that's not an easy thing to discuss. Now you have someone with autism who's now been assaulted, sexually assaulted or physically assaulted. You may see a very big spike in their behavior. They may be out of control. They may be totally regressed. They may be catatonic. We could see it all.
Yeah.
So at that point, that's when you really have to say, there's something more here, and what's the something more? And once again, it's our job to put the fish in the boat to kind of, investigate it a little bit further and try to get that information so that we can, do the best that we can.
All right. And one of the other things is, not so much a victim of, crime, but of a circumstance, like you had mentioned car accidents. And so we know that you do training with also firefighters and the paramedics in town. What do you try to convey to them? How should they, kind of take your advice into heart when they're, going to a home where they know that somebody is, autistic and there's some sort of, a fire, even if it's not a full blaze or something. But
I think in that situation, we're definitely we're joined at the hip between the police and the fire, because many medicals we get sent.
Yeah.
Just before they do, and sometimes we get there a little bit before them because we're out and about and we're mobile. With injuries, the golden hour, we got to figure out what's going on, triage, and report that back to the fire and the paramedics that are responding, that have higher levels of care and training and equipment. And that's, find out, locate, communicate, and let them do their work. If we recruit the assistance of the fire department for a lost person in the woods, explain to them this is an autistic person. They may not respond to you. They may not look at you. They may sense danger. They may have no fear of danger. There's a lot of what ifs. Particularly, now you roll up on a scene and you see we see somebody with one of these stickers and it's a bad car crash. So I explained to the fire captain or the chief or the lieutenant on the scene, I think we have a person in the automobile who's autistic. In the car, you might have to extract them. So they're going to be like, that changes things. Of course, nobody's going to like having to sit there and be extracted from a car. Well, nobody. No. But it helps us to pass that on. I think the timely, factual information is going to be the maker or the breaker of police, fire, anybody in public service or first responders.
Yeah, and it seems like it would be important for, like the paramedics in the ambulance, yes, when they're trying to assess injury or something to have a heads up. This person might not be verbal or, limited verbal,
Yeah, you get an autistic person who's nonverbal, and any type of light tactile touch could be considered aggressive. So, try to find out best we can, find a caregiver, find a parent. If we have the information, what do we do to redirect them? Nobody likes having a needle put in them, nobody.
Right.
But it's a necessary thing if you have to go to the hospital, an IV, whichever. How are we going to do that? What can we do? What can we do to get that so nobody gets hurt?
Right.
So that they get the care that they need, and everybody goes home safe. It's not always pretty, I guess. Nothing's 100% in our world,
Sure.
but we're sure going to try.
Right. But it's good for them to have that heads up because they might, just to know that, this person might react differently than other patients would.
Exactly.
All right. So we're kind of wrapping up. I just wanted to circle around a little bit just to, the idea that, more information that you guys have, the better, and that you would, that you kind of want to work with families or caregivers ahead of time, and I think that's important. You had mentioned, during the break that, getting, if someone has a child with autism, get them familiar with police officers and have them come down to the station.
Yeah.
So just talk about, if someone's watching this, realizing that's a possibility for the first time, what's the benefit of it, and what can they do?
Oh, what's the benefit? Any interaction with the police, we strive for it to be as positive as we can. If you're a citizen of the town and somebody's with autism or any particular concern or special need, come talk to us. We're here to help. And we can at least explain certain circumstances. If it's a law and this is how the law reads, then you understand. If it's something that's not so cut and dry, like an autistic person in the home, what can we do to help you keep the person safe, keep your home safe, keep them from wandering? We can discuss all sorts of different techniques, whatever works for you. Mm-hmm. Some things will work, some things might not. We don't know, but we can keep trying until we find the one thing that works. So hopefully, disaster doesn't strike. Come talk to us. We're your police department. Our door is open 24 hours a day, 45 Center Street. Come talk to us. See something, say something.
Right.
Everybody has to interact with us somehow in life, be it from a crash report to maybe something bigger. Let's hope not.
Right, of
But
course.
in the autism world, come talk to us. Come see, come help. Let us help you. Let us, come, we're not going to put a big sign out, hey, an autistic person here. We're not going to give a scarlet letter, but we're here to learn, and it's a partnership. It's a partnership between the parents and the police, the fire, the schools. Better to take 5, 10, half hour talking to us in a nice, calm environment than the day disaster comes knocking on your door, and then it might be too late, or
Right.
it might be a big wow. We can't really, can't unring a bell at that case, at that time. So.
Or even just a delay because you didn't know ahead of time, that you were working with somebody.
Exactly. Okay. There's nothing wrong with, give us a little heads up. How many times have you ever said, oh, if I only knew beforehand, this is what we're trying to hope for. And it helps us with recognizing, it helps us get resources into the town, into the department to help people, when it needs to be helped. It helps us to learn, and the more people we interact with, the better we'll do it.
And where can people get these forms?
You can get them online, Autism Speaks, or come see me at the police station. I've got hundreds.
Okay.
I can mail them to you, fax them to you, you ask, we'll do it.
All right. Well, it's been a fascinating conversation. I think it's a really, good thing to have, this sort of program in place, this training in place, this sort of thinking in place. So I appreciate you coming in and sharing it with us.
Thank you for having me, Rich. Thank you.
All right. Thank you very much.
Good to see you.
You too.
So there you have it, a look at what Burlington police officers do to help mitigate situations when they have to work with people on the autism spectrum. I'd like to thank my guest, Officer Stephen Papagno, for his time this month. I'd also like to thank all of you for watching. We'll be back next month with another edition of BNEWS In Depth, so stay tuned.